recording. All right, it is 12:01 and we are ready to begin. I see a lot of people hopping on, and that's always awesome to see. So welcome to our webinar on navigating summer safety. Excited to have everyone with us today. My name is Mary Lizakowski, and I'm a Coalition Health Director with Foundation for a Healthy North Dakota. It is a nonprofit established in 2022 with a mission to promote health and wellness across North Dakota by working at the community level. We are growing a statewide coalition that will enable communities to collaborate and work together on common initiatives. And by becoming a member of the coalition, you will be the first to know about educational opportunities such as this, updates on relevant public health information, legislative news, as well as access to digital advocacy resources and toolkits. Just a few housekeeping things to touch on. Webinar attendees will be automatically muted for the presentation. If you have questions, please put them in the chat box or the Q&A. We will leave time in the end to answer any of those questions. And after the presentation, a link to the recording will be sent out along with an evaluation survey. It is my pleasure to introduce Carma Hanson. She is a coordinator of Safe Kids Grand Forks, a position she has held for nearly 30 years, trained as a neonatal nurse, and having spent her early career in that field and as the manager of the NICU and pediatric unit at All True Health System, Carma has taken her love of children and her passion to injury prevention in the Safe Kids Coordinator role. The coalition she leads covers Northeast North Dakota and Northwest Minnesota, and their focus is on keeping kids safe at home, at school, at play, and on the way. Carma has served on many state and national advisory boards focusing on education and policy development. She is trained as a certified child passenger safety technician and has certification in special needs transportation and transportation of children in ambulances. Her passion for injury prevention and desire to form effective coalitions and partnerships has helped to make Safe Kids Grand Forks a reputable and trusted source for childhood injury prevention in our state and region. And I will then turn it over to Carma.
Well, thank you so much. I appreciate that introduction and look forward to meeting with you today to share about a wide variety of topics. When we visited with Mary earlier about doing this, we started around the topic of water safety, and then we started talking summer safety, and it's kind of evolved into a lot of slides about a lot of topics. We're going to have to move quickly through a lot of them, but I have shared my slide deck with Mary and told her that she can send them out for you. I have also included some links in the slides that I will direct you to, because there are some videos that I would like you to watch that we won't have time to do, but one of them that I think is incredibly poignant on the topic of heat stroke. So with that, we will get started, and I thank the Foundation for Healthy North Dakota for inviting Safe Kids Grand Forks to present today. As she said, my name is Carma Hanson. I'm a nurse, and I love all things injury prevention. We at Safe Kids Grand Forks say that our mission is to keep kids safe at home, at school, at play, and on the way. And our focus is on preventable injuries. So those things that people sometimes refer to as accidents. And our strength is in creating coalitions and networks of people who come and share that same mission with us and help us in that work. These are some of the areas of focus in which we provide education and resources, and you'll be able to find a whole bunch of these on our website. This is our coverage area. Mary kind of said we cover Northeast North Dakota, Northwest Minnesota, but I want to give a shout out to our other coalitions that serve North Dakota and into the Minnesota area as well. Safe Kids is part of an international organization. You will see here there are over 400 coalitions around the United States, and we're in 30 countries around the world as well. And so we have a great network of people who really kind of come together around that topic of injury prevention and help us with research and curriculum development and all things injury prevention. We're going to start out our talk today talking a little bit about water safety. We've had an early spring in North Dakota, but it has certainly been a cool spring with lots of rain. I know that this is the time of year when a lot of our pools are starting to open up after our high school and college kids get done. Those are oftentimes people that serve as lifeguards in our communities. And so many of those pools are just starting to open up. So as we go through this presentation, I challenge you to take out a notepad and write down one or two things that you, as maybe you're a parent, maybe you're a caregiver, maybe you are with an agency, maybe you are an injury prevention expert from another area of our state, maybe jot down a few things that you get as, hey, maybe I could do something about that topic. Maybe it's share on social media or include in a radio interview or hang a poster up in your staff break room, or maybe it's talk to your kids or your grandkids or whoever that may be. But throughout the presentation, if you just kind of keep a little list of things that you could do, hopefully that what we share today, that education will go out as a stone thrown in the water, but it will have a ripple effect throughout our state in ways in which we can do some work around the topics that are going to be discussed today. So when we look at drowning, drowning is a leading cause of injury-related death for children ages 1 to 4. If you look at all risk categories that we cover up to age 19. Motor vehicle crashes is the leading cause if you include all ages up to age 19. Under a year, leading cause of death for that age group is kind of that choking, suffocation, safe sleep related topics. And then the age 1 to 4, drowning is the leading cause of death. You can see that in 2018, there were 918 children under the age of 19 that drowned. And we know that that is just the tip of the iceberg, that there were about 7,000 more that were seen in emergency rooms with near drowning incidences. Being around water is something that is a sport or an activity that we can do all throughout our lifetime. And so having that water safety skill is really critical as we think of, if we can expose kids to water safety at an early age, it will go with them in later into life as they go out and canoe or pontoon or boat or fish or ski or tube or go to the pool and swim. It is one of those activities that really is a lifelong skill because it's an activity we can participate in all throughout our lifetime. I mentioned this already, that there were 918 kids that went in that died, and another 7,000 who went into the ER from drowning or near drowning. And we know that for every child who drowns, another 8 receive emergency care. Most of the kids who survive a drowning incident are those who are discovered within about 2 minutes of submersion. Drowning is one of those things that you need to be very quick to respond. You need to be readily available. You need to be extra vigilant about kids or really anybody in or around water, because time is of a critical essence as it comes to survivability from a water incident. Most of the children who die were found after 10 minutes of time submerged in that water. So when we talk about sources of drowning, we're going to focus mostly today on pools and lakes and rivers and that kind of thing as we talk. The focus of our talk today is on summer safety. But that being said, I also don't want to ignore that there are drownings that are occurring in things such as bathtubs. I sit as a member of the North Dakota Injury Prevention Coalition, and we oftentimes get updates from the Child Fatality Review team, which does the hard work of reviewing all of the childhood deaths in the state of North Dakota. And oftentimes they will reach out to us if, as Safe Kids coalitions and coordinators, if they are seeing a trend with our injuries and deaths. And a couple of years ago, I did receive a call from Jennifer Graybar, who is the coordinator of the Child Fatality Review Team. And she reached out saying that we had seen an increase in the state of deaths from drowning in things such as bathtubs or non-traditional places like a pool or a river. And so I'm not going to focus a lot on that today, but I do want to raise awareness to the fact that when we're talking water, don't just think those very first of mind things such as pools or lakes, but also think of things like a bathtub in a home, parents getting up and leaving and answering the door, or checking on supper, or attending to another child, or taking a quick phone call, thinking that a child will be safe in a bathtub. We're going to go back through some tips from all of these areas, so we'll get into those in more detail on subsequent slides. When we think about drowning, a lot of the movies portray it as a kind of a help me, help me, help me, I'm drowning kind of a thing, when in fact drowning is a very silent activity. As a nurse, if you think about the physiology of drowning, these are people who have gone submerged below the water, and they are likely getting water in their mouth and their nose and their lungs. When their head does come up, if they could get their head above water for a brief period of time, they're not using any air that is in the lungs to scream and shout. What they're doing is they're gasping and trying to bring air in that kind of survive and thrive mode. And so they're usually not yelling and screaming at all. What you might hear is a splashing type of a sound, but it is clearly not a call out for help. So because of it being so silent, it's really important that the people that are the caregivers or the people that are your water watchers are really paying attention, not reading a book, not distracted on their phones or with headphones in, but really having that watchful eye on the people that they are attending to in the water environment. I want to talk a little bit about the role of lifeguards, and this is by no means a shot at the great work that they do, but I also want you to understand that a lot of the people who serve in the role of a lifeguard, where they are taught about the importance of paying attention and being mindful and not being distracted with phones or side conversations or things like that. These are oftentimes young individuals that maybe don't have some of the life experiences that adults or older adults do, that understand the consequence of that responsibility. And I will say their role is to monitor really the whole pool. They cannot keep their eye on every one single individual. It's the pool as a whole. And so when you are sending or looking at kids going off to a pool, it is really important that they're not just sent there on their own accord or dropped off in the morning while mom or dad goes to work, thinking that that lifeguard is going to serve as a babysitter. That is not their role. It is important that kids have other active adult supervision there at the pool with them, so that they know that they have individual eyes on their child and not the lifeguard's responsibility of watching everybody in that pool. And so really kind of having that sense of if you've got kids that are staying home alone, can they go to the pool alone? Can they go to the pool with a friend? Can they go to the pool with another adult? And what is that expectation for those kids, so they don't just assume that they can go, and you're leaving that responsibility of monitoring those kids simply to the lifeguards that are there. When you are at the pool, again, that being within close proximity, being within an arm's reach, or the ability to jump in really quickly, and making sure that somebody that is an experienced swimmer is with them when they are there to monitor those kids. So what does active adult supervision look like? I've got a couple of images here on the slide that show some that maybe are and some that are maybe not. Active adult supervision doesn't mean I took my kids to the pool and now I'm thoroughly engrossed in my novel, or this is a great opportunity for me to catch a a much needed nap, or I'm going to go and sit in the restaurant that's near the pool, but not really watching the kids at the pool. So the top left, clearly engaged in active supervision. They're in the pool with the kids. Here's a dad or a caregiver that's right at the water's edge. While this adult is by the edge of the pool, their attention is clearly drawn away from the pool, and they're very engaged in a phone conversation, probably not as active as we would like it to be. The one in the middle here, yep, they're right at the water's edge. If that's a glass of sparkling water and they're of sound mind and being, probably that's active adult supervision. If they're clearly intoxicated or something like that, probably not what we're talking about with adult supervision. Here, clearly got their eyes on the pool. They're by the pool, not really paying much attention to it. And this one, clearly not very engaged whatsoever. They're very involved in their afternoon naps. So again, that active adult supervision, maybe you have kids that have a summer nanny. Talk to them about what is your expectation if they're taking your kids to the pool, that they're not on their phone, that they're by the pool, that they're within arm's reach. And don't assume that they know that that's their role. Talk to them about what that means. We have something at our office. It's called a water watcher card. And this kind of comes down to the idea of drowning incidents that occur. Maybe it's at a backyard barbecue or at a 4th of July pool party or something like that, where there's a ton of people around. And it's one of those, everybody thinks somebody is watching when in fact nobody is. And so when you are near water's edge, be it a pool or a lake or river, whatever, assigning somebody as the water watcher, so that if there's 20 people at a family reunion and I know that I'm the water watcher to watch the 5 kids that are in the pool or the lake, that's my job. If I need to go to visit with some family or to put a meal on or to go to the bathroom or to get out of the hot sun, that I really kind of tap out to somebody else. We've got a card that comes both on a lanyard and on a kind of a curly plastic wristband type thing that identifies the person in charge of those people in the water. And so it's a great way to be very intentional about who that person is. We had a child die in a pool here in Grand Forks many, many years ago that was a part of a family reunion that was going on. And while the adults were all a part of the gathering and visiting with each other, there were kids in the pool, and somebody thought that he was being watched when in fact nobody was watching the kids. And so that very intentionality of assigning somebody. This is what the cards look like. They're small. Ours have this water watcher information on the side saying I'm the designated person. On the opposite side, it has the steps for CPR. We have those free of charge, again, on a lanyard or a little wristlet. If you would like one of those to pass out, to loan to people, to have at your pool, your lake, whatever, you are more than welcome to contact our office for that resource. When we think about water safety, many of us, our mind goes to swimming lessons, and how many of us probably as a young child took swimming lessons. And we would highly encourage that. In fact, swimming lessons are something that it's not necessarily about making you be a proficient swimmer. We know that there are various levels you can participate in swimming lessons, and it's not necessarily that you need to get your child through level 10 to be successful. Even if you can enroll them in the first couple levels of swimming lessons, that will give them some of those very critical life-saving skills that are important to save a child should they fall into the water unintentionally. I will say that there are 5 skills that are recommended that children learn. And the American Academy of Pediatrics has a recommendation that all children by age 5 should have had some type of formal water safety education. The goal behind that would be that they would learn these 5 survival skills for a water environment. The first one is to be able to step or jump into the water over his or her head and return to the surface, so they know how to come above the water. That they can float or tread water for 1 minute. That they can turn around in a full circle and find an exit from the water. that they can swim 25 yards to the exit. Why 25 yards? We know that most drowning incidents occur within about 20 feet of shore or from safety. Could be the edge of the pool, could be the dock, it could be a raft. Most of them occur within 25 yards. So, or within 20 yards. So that 25-yard ability to swim is why they're looking at that number. And that they can exit from the pool or water without using a ladder. So again, encouraging the swim lessons for all children before age 5, with the idea that they would learn these 5 water survival skills. Another part of water safety education that we do need to focus on, we had 2 near drowning incidents that occurred in our community several years ago. They were children who were part of our New American community in town who had gone to a pool at an apartment complex. After the incident occurred, and the one gal was resuscitated and discharged, and the cousin was saved. We took this family back to the pool to do a television story, and they were talking about the pool and why one got in the shallow end and one got in the deep end. To them, it all looked like flat water. They didn't realize that there was a deep end to the pool, and that while the top looked level, that underneath it was going down. And so we need to talk to our kids about the fact that there is a shallow and a deep end to a pool. That's important not only from a drowning prevention standpoint, but it's also important when you're talking about diving, so kids know that they should not be diving in head first into the shallow end of a pool. And so teaching them about where to find that depth and what it might look like under the water is really important. Other parts of water safety education is really around the idea of reach, throw, and go. Talking to kids about what does reach mean, laying down low, reaching with your arm, a branch, a pool noodle, a fishing pole, anything that they could reach out to the person with. The next step in a rescue would be throwing something. It could be a life jacket, a pool noodle, a beach ball, a water cooler, a fishing line, and then finally go. And go doesn't mean go in the water, go means go and get help. And that's what actually occurred in the situation here in Grand Forks. There was an 8-year-old with her cousin who was 8 and her 11-year-old sister. We know that one of the girls, 8-year-olds, got in the shallow end but started walking out and going underwater. The 11-year-old sister got in the deep end, not realizing it was a deep end. And our friend Bonita, who we went out and presented a Lifesaver Award to, she had been to a water safety class that we have every year, 3 weeks before this incident occurred. And she knew to reach for her cousin, pulled her out of the water. She couldn't find her sister, thought she had gotten in the deep end. She knew she herself could not swim. She ran to a balcony and found an adult that was out on the balcony who jumped down, got into the pool, got her sister out and performed CPR on her. She was brought into our hospital and discharged 3 days later. When we took Bonita back to that pool and talked about how did you know what to do, she had been taught about reach, throw, and go for help. So very basic steps, but really critical ones that kids know and understand what to do in the event of an emergency. Backyard pool safety. Many homes within our area have backyard pools, be it above or below ground pools. I would say if you do have a pool in your backyard, that you should also take responsibility to learn basic CPR and basic water rescue. There are in-person classes, but there are also a lot of online classes that you can take just to have kind of that overall view of what you do with CPR in a CPR situation. I would also encourage you to download a CPR app on your phone. If you panic in that emergency situation, you could have somebody start that app that will do a very brief refresher and kind of talk you through a CPR situation if you need help. When we're talking about backyard pool safety, there are a lot of below ground pools that are in the backyards of homes, and almost all cities in the state who allow a permit for a below ground pool do have fencing requirements that you have to have four-sided fencing. Many of those fencing guidelines will say you can have three-sided fencing as long as the fourth side of the fencing is the home, the back wall of the home. However, what I would say with that is I would encourage a little bit of caution about that, because that adds an extra level of protection that the homeowner has to have as it relates to assuring that the doors, windows, and even things such as a doggy door that might be coming out of that home are secured so that kids can't get out of the home and get into that pool. If you really want to be safe about it, you wouldn't count that back wall of the house as your fourth side of that fencing. You would actually have a buffer space between the house and where another fencing starts, and have your actual four-sided fencing. That fence should have what's called a self-closing gate or self-locking gate, so that when you go through it, you don't have to turn around and close it, that it has springs on it, and that it automatically closes behind you. So if kids get into it and they forget to close it, that you know that it'll automatically close and latch behind you. Also important to know, if you do have pools, where is the pump shut off for that? There have been new standards to pool drains and pumps. After many years ago, there was a granddaughter to Jim Baker, who was a press secretary for one of our US presidents. His 6-year-old granddaughter got trapped up against the drain in a jacuzzi, a hot tub, and drowned in that pool. Following that, there were some changes that were made to pool safety standards. One of them is that if you have a pump on a hot tub or a pool, that it has to have an automatic shut off, so that as the suction builds up, that if that gets too strong, it will automatically shut that pump off. There have been children where their intestines have been eviscerated, where they've sat on a drain and that pump is so strong it will literally disembowel them. We have had situations where kids are trapped up against pool drains or jacuzzi pumps because they're using a jacuzzi as a swimming pool instead of a sitting pool, and their hair or their swimming trunks get caught up against that. So that auto shut off of that suction was one of the changes that was made. Another one was made was the design of the pool drains. Instead of them being flat where somebody could sit on it and have that buildup of suction, they are now rounded, so that you cannot create that suction barrier. But that being said, I will tell you that while those the Virginia Graham Baker Pool and Spa Act was put into place in 2007, it did not go back and require retrofitting for home pools. It did for commercial pools, such as a hot hotel or a pool or a country club or something like that, but it did not go back and require it for home pools. So it is important that we talk about pool and drain safety with kids as well. Below ground pools, above ground pools, we talked about the four-sided fencing. Below ground pools, most communities do not have an ordinance that impacts above ground pools. So you may say it's a hot summer day and I'm going to go out to Menards or Lowe's or order one off of Amazon. $200, $300, $400, $500, you can get yourself an above ground pool, set it up and have it functioning within a matter of hours. There is nothing that says you have to have a fence around that. That being said, it doesn't mean that you shouldn't have a fence. There's just usually no laws or ordinances that require that. So I would say if you notice that in your neighbor's backyard, be careful that you are watching where your kids are at so they don't get into a neighbor that might have an above ground pool. If you do have one, storing that ladder, removing it from the area by the pool and storing it in a shed or under a deck or in a place where kids can't access that and get into that would be really important. And then another tip is always remembering to clear the pool of floaties, pool noodles, toys, balls, things like that that would be intriguing for young kids. Life jackets, we talk about life jackets when we talk water safety, and they are really important, not just for those that are in the water, but those are on, around, or near the water. They are a device that will allow somebody that maybe has a medical condition or slips and falls and hits their head on a boat motor or a dock to be held in a floating position. There are a variety of types of life jackets that can be worn, and we encourage you to pick the one that is most appropriate to the sport that you are going to be participating in. We really want to encourage people to think of life jackets not as worn by people who can't swim, but really by everybody who's on, in, or near water, and that it's just a part of your sports gear. And then reminding people to not rely on floatable, inflatable things such as water wings or a floaty, an inflatable ring for something that needs to be a life-saving device. Here are the different types of flotations. They're type 1 through type 5, and you will notice that there are a variety of styles that can be purchased based on the type of activity that you're going to be doing. And the cost is certainly different between them. You'll notice in my first bullet here that in North Dakota law, anybody who has a boat over 16 feet in length is required to have a flotation device, one for everybody on board, but also a throwable, and that would be the type 4. It might be a flat cushion type. It could be a rope that's in a bag. It could be the life ring buoy, but they must have a throwable device as well. Both North Dakota and Minnesota law requires a flotation PFD for anybody under age 10 at all times when in a motorcraft or being towed. But that being said, the boat, we would encourage everybody to wear it, and you do have to have enough flotation devices for everybody that is on board. This is a poster that we have available. If you have a place where you could get this put up, talking about how to choose a life jacket, how to fit it properly, I can send you the link to the posters. We would love your help in getting this put up in and around bodies of water. If you need them printed and laminated for a place that's outdoors, such as a pool or by a lake dock or that kind of thing, please reach out to us and we can help with that. I want to talk a little bit about infant life jackets, and they are formed a little bit differently than a regular life jacket, in that if you look at the age or the size of a newborn or a toddler, their head weight is about 25% of their body weight. They're disproportionately head heavy. And so if you have a young toddler that is walking on a dock or something and falls in head first, and they don't have on a life jacket with this pillow cushion on the back, the heavy head is going to stay down. The life jacket is going to think that that's the bottom part of the body, and it's going to keep them with their head down. Because of that pillow that is on the infant life jackets, what it does is two things. It moves them like this into an upright position, but then it also allows a child who may not have good head and neck control as an infant, it allows them to lay face up in the water with their head being supported by that pillow cushion. So again, it's really important that you know what style and type of life jacket that you need, not only for the activity, but for the size of the child or adult as well. This is an example of an ill-fitting life jacket. Somebody has put one on this young child that is clearly made for an adult, not sized right, something that should be checked with each of the people that are going to be using the life jacket, so that the ones you have in the boat or the canoe or by the pool or whatever are not just any old life jacket, but ones that will fit the person that might be using it. We do life jacket loaner programs. There are a variety of types. We also sell them at our office. and you can get them from us at any time. The life jacket loaner programs that we do, we encourage people to think about if they have guests coming to their lake that they might not have the right life jackets to fit, or maybe they're sending their kid off to a basketball or a Bible camp, but knowing that they're going to be participating in water activities, rather than relying on the camp having the appropriate size, maybe send one along. Maybe your kids are going to a friend's house for the weekend. Those loaner programs make a great way to assure that you get the right size life jacket that is needed. We have these flyers that are available. We run a life jacket loaner program through our Grand Forks YMCA here, and we can help other communities get those set up if you're interested. You can check a life jacket out, infant through adult sizes, no charge for up to 2 weeks at a time. There are also things in our state called a loaner board. And what these are is, it is a board such as this, a sign down by the water's edge, usually at the boat ramp, where there's hooks or carabiners that the life jackets are put on. If you need a life jacket for the day, you simply grab it off of that loaner board, take it out and use it. The life jackets are marked with our names on it. And then at the end of the day, you just hang it back at that loaner station. If you go to the Game and Fish site, you will see where they will list where their loaner stations are. And then the Game and Fish sponsors them in our state. And then we have also received some funding through some grants through the CETO Foundation. If you're interested in getting a life jacket loaner board put up in a body of water near where you are, I would encourage you to look into the grant funding through the CETO Foundation, which does that every kind of January, February-ish. And then they provide you a sign and the life jackets to put up for borrowing. Just a reminder, it takes 3 to ski, we say. By law, you need to have a driver, a spotter, the person that's watching the back, the driver that's watching the front, and the person that is skiing. And that's whether you're on a jet ski or behind a boat. Anytime you're towing somebody, it does take 3 people, driver, spotter, and the skier. I want to visit just a little bit about carbon monoxide on boats. We talk about carbon monoxide a lot of times when we're talking about fish houses where there might be a generator running, or a hunting shack that might be running off a generator, or our homes, our garages, things like that. But we don't oftentimes think about carbon monoxide as it relates to boats. And anytime there is a fuel that is being burned, such as gas, there is going to be carbon monoxide released. It is why boats have blowers on them in an effort to, start that motor, run the blower, and try to clear the air of that carbon monoxide. That's what that blower is there for. The danger with carbon monoxide is that it is highly lethal. It has no smell. No, you can't see it. You can't taste it. And so I could have high carbon monoxide levels going on in my office right now, and the only way I would know it is if I had an alarm that were in my space, or if I put 2 and 2 together about the signs and symptoms of carbon monoxide. The problem is that those signs and symptoms, headache, nausea, vomiting, tiredness, achiness, headache, those are all things that oftentimes people don't say, oh gosh, I'm not feeling well today, I must have carbon monoxide poisoning. Typically they'll think, oh, I've probably been out in the heat or the sun too long, or maybe I'm coming down with the flu or something like that. They go in, they lay down. Now, that being said, if they can get away from that carbon monoxide environment, usually they'll be fine. It's if that carbon monoxide is high in the home level and they stay in there and they go to their bedroom and lay down, that we run into problems. If you were to have a child or somebody in the boat and they're like, I'm not feeling well, and you just lay them down on the back seat of the boat, again, they'd be within that same environment. And so it is important that people know to use the blower on their boat, that if they're just sitting idling, that they turn that blower on. And if anybody is having any of those symptoms that we talked about, that they think about carbon monoxide as a potential danger. These, I'm not going to spend a lot of time on it, but if you're interested in implementing any water safety education within your community, these are some of the things that we do. This is a course we teach called Kids Don't Float to school age kids. We do a splash into safety in many of our communities around the summer at local pools. And then lastly, I just want to mention on the topic of water safety, that if you are working with children or have a child that has special needs, particularly those with autism, those kids are highly attracted to bodies of water. And we know that they sometimes will escape from a house, a car, a park, different places, and are oftentimes drawn to water. There are things that are out there that are bans, such as this one, available through these. The state of North Dakota has a project called Find Safe, where they can equip a child or a vulnerable adult with a band that they can track them with should that child go missing. If you want more information about that, please reach out and I can help get you directed. When you talk about water safety, color of the swimsuit is really important. You can see here those swimsuits in the water and how some are much easier to see than others are. So when picking out swimsuits, think about that. And then I want you to think about water safety in non-traditional areas. Buckets of water on the driveway, you might be washing a car, koi ponds, water that might accumulate in ditches. We've had a lot of rain in our state this spring. A backyard area that might be lower, such as a ditch or an area of your yard that's lower. And think about keeping track of children around those areas or not allowing them out to play alone. In the handouts that I'm going to send you is a lot of water safety resources that are listed here and some great videos. One of that I would direct you to is the American Red Cross. They have a fabulous water safety website, and these are some of the things that they have available on those websites. We're going to switch gears right now to talk a little bit about ATV safety. This is a topic that as summer comes around, we see a lot of ATVs. This is a school parking lot, not very far from where we are. You can see a lot of golf carts, rangers, ATVs, kids that are not old enough to drive a car yet. The parents are putting on these big, large devices, and many of them come, particularly an ATV, with no protective mechanisms, no seatbelt, no rollover bars, no airbags, nothing of a protective mechanism. These pieces of equipment have changed in use. They used to be a farm utility vehicle. They have now switched to used at the lake or used to get from my friend's house to your friend's house because I'm not old enough to drive a car. And we are seeing the number of ATV injuries and deaths in our state increase considerably. I would highly encourage people to learn more about the dangers associated with ATVs. I'm only going to have a brief period of time today in which to talk about this subject, but I would encourage you to learn more about it. Many states do allow use of ATVs by people who have taken a course prior to the age at which they are allowed to get a permit, which is 14. They, like I said, they're oftentimes, if the kids have taken a course, while it does make them a little bit more better equipped to drive on these vehicles, they certainly do not mean that it doesn't mean that the kids have the upper body strength to bring these big, heavy vehicles to an upright position. I would just caution you that many ATVs can weigh up to 700 to 800 pounds, go up to 70 miles an hour, and they're meant to be driven on uneven terrain. And so if you're in a ditch or a field or on a hill, many of them are prone to tipping over. And what we know is that oftentimes the people that are riding them do not have the upper body strength to bring them back into an upright position. This slide shows you information about how to register for the ATV safety course that is offered in the state of North Dakota. I won't go through the details, but I did offer that as a reference in the handouts. The American Academy of Pediatrics and Safe Kids has actually come out with a recommendation that nobody under the age of 16 should be riding on an ATV, particularly an adult-sized one, because of that lack of upper body strength to move it to an upright position. The industry does sell ATVs that are of lower cc capacities that you can put governors on the speed. They are a lighter weight. If you would be looking at having a child use one, we would highly encourage that you buy one that is age appropriate or size appropriate. I don't have time to play this video, but I did include it because it talks about how these vehicles, the ATV industry even says these are not meant to be driven on concrete, cement. They're meant for off-road terrain, and we will see many injuries that occur because people are driving them now on city streets and county roads and things like that. The wheels of these vehicles grip the road differently, and people can be driving down the road and that wheel can grip the road and literally flip that ATV and flip the rider off because again, they're not meant for concrete roads and things like that. So I would encourage you to learn more about that. We know that ATVs are designed with four wheels. Three-wheeler have been banned years ago because of the propensity to tip over and the dangerousness of that. ATVs are designed with the seat. It's an elongated seat where the driver is meant to be positioned equally between those four wheels. Now that long seat is not there with the idea that, hey, let's add on 2 or 3 more kids to the ATV because I have this big long seat. The seat is meant to be an active environment where as you are going up a hill or down a hill, you can slide forward more if you need to, or you can back up on that seat to shift your weight if you are at an angle of some type, either going up and down or off to the side. But what many people think is, oh my gosh, look at this big long seat. I can take 2 or 3 other kids with me, and they'll stop and pick up their friends on their way to school. As you do that, you are shifting the center of gravity of that vehicle and making them very, very, very prone to tipping over. We know if you take a look at this, this is the center of gravity on this ATV, and there is a point at which that ATV is going to not be able to hold its position in an angle, and it is going to tip, and we know that to be about 37 degrees or about 44 centimeters with the wheels off the base level, or where the bottom wheel is, about 44 centimeter discrepancy between the lower wheel and the upper wheel. So that's not a very big incline. And you look at some of the ditches in which these are navigating, and it's easy to see where they could easily tip over. If you're riding, important to have the gear. While helmets are required for anybody under age 18, what we see by looking at the injury data is that a lot of the deaths and injuries are occurring not just from head injuries, but from crushing injuries, where that big heavy piece of equipment has landed on the chest of the child or even adult occupants. And so wearing not only the ATV helmet, but boots, glove, goggles, long sleeve pants, and then a chest protector would be highly encouraged because of that crushing injury that occurs when these many times tip over onto the people or person that is riding on it. It is important that you select the correct type of helmet. We at our office sell bike helmets and multi-purpose helmets each spring and fall and throughout the year. The multi-purpose helmets are designed for things like scooter, skateboarding, and rollerblading. They are not meant for anything motorized. Because of the speeds at which ATVs can travel, it is important that you have a helmet that is designed exactly for something with a motor, because they are a heavier plastic and they cover more of the head and the neck area and the eyes and the face, in which you can have injuries occur. So having the appropriate type of helmet and also size of helmet is really important to safe ATV use. I think we already talked about that one, so I'll skip by that. And then this talks about that having, if kids are going to ride, having them not be on an adult size ATV. This is the off-highway vehicle safety guide that the North Dakota Parks and Rec puts out each year. You can scan that QR code and get taken right to the site where you can download that, or you can contact us and we can mail you out a hard copy of it. That is also the site where you can find more information about how to register for their ATV safety courses. They'll teach things at that class, such as rider communication, how to use the rules of the road, and communicate just as if you're on a bike, because ATVs are not made with turning signals and headlights and things like that. There are great ways in which you can share ATV education within your community, farm camps, through your parks and rec, a lot of curriculums that are out there. We have some of these static displays. If you have a way to put this up and display this in your community, at a mall, a store, a post office, a school, a clinic, we would love to share something like this with you to put up. And then also think about doing some education within your schools if you have that capacity to do that. We do some work with bringing out this tilt table that shows about the tippiness of ATVs, using full-size ATVs and putting kids on it and demonstrating just how big those machines are. This is some of the work that we've done with ATV safety, from radio interviews to at farm camps, ag expos, things like that. We've done a lot of work with social media. There is an ATV week in May, June, and October. Great time to promote ATV safety. We've done stuff with school newsletters. If that's something that you can share or would like to get those to have available for your use, please reach out to us. And then this is our ATV safety sheet that provides a lot of ATV education. Many communities are now providing ordinances about allowing ATVs and golf carts on city streets. I would encourage you to highly get involved in advocating against that, just again, because of the dangerousness of trying to mix ATVs with cars, and the dangerousness of having people on concrete where those pieces of equipment are not designed to be. One of the last topics we're going to talk about, I guess I have two, we're going to talk a little fire safety, but also vehicle heat stroke. This is one that is, I call it a you don't know what you don't know topic, and it is one that people need to be aware of. This is a great video that I'm going to encourage you to watch. It is on our website, and I will post it in the chat in just a minute. It's about a 7-minute video, but it talks, this mother actually lost her child to a heat stroke incident after that child was forgotten in the backseat of the car. This is a topic that many people say, I would never do that. I'd never forget my child. And those are the very people that make me most worried, because if you don't think it can happen to you, you're probably not going to take the steps to prevent it. Every year, about 37 kids die of heat stroke injuries, and it occurs to good parents. This is the numbers by years. You'll see that those numbers are going down, but it's still about 30 to 40 kids every year that die of heat stroke. It does not take a hot day. The temperature inside your vehicle can heat up about 40 to 50 degrees hotter than outside. And so on a mild 60 or 70 degree day, your temperatures inside that car can get to be up to 100, 120, 30, 40 degrees. You'll see that it doesn't take very long before that temperature starts to rise in the vehicle. And after about an hour, it's already reached about 40 to 50 degrees hotter than outside. Most of these deaths occur to kids that are under 4 years of age. As you can imagine, they're in the back seat, they're forgotten, or they're kids who maybe wander off and get into a vehicle that is unlocked. And we know that young children's body temperatures overheat much quicker than an adult's does. And so knowing that your car is locked and those keys are out of sight and out of reach is really important, even if you don't have kids in your family, but you have your car out on a driveway where maybe a neighbor kid could get into that vehicle. These show the hot car deaths by state. They do happen in our state. They have. We have a brochure I'm going to show you here in just a second of a mom who, the one that was in that video, who lost her child, who has helped us to create a great handout on heat stroke. More than half the time, these kids are unintentionally left in the vehicle, but we do know that there are a fair number of them that gain access to the car or were intentionally left in that vehicle. We say that if you are trying to prevent heat stroke deaths, we want to use the acronym ACT. A is avoid heat stroke, making sure you don't leave your kids alone in a car, locking up your car, putting the keys away, creating reminders. It could be with technology. It could be with something so simple as a little vinyl cling that we have that can go on windows. It could be putting your phone or your briefcase in the back seat, putting your purse, in the back where you need to get it, putting a stuffed animal in the car seat that you move to the front when you put the child in it. And then T stands for take action, which means if you see a child alone in a car, call 911 as soon as possible. So you get emergency personnel and law enforcement there who can break into that vehicle and successfully get that child out. So we say park, look, lock, always check that back seat and make sure that you don't have a child that is left in there. There are high-tech ways such as rear seat sensors, apps on your phone, on your car seat chest clip, or add-on products such as like the Apple little sensors you can add to your suitcase or a car seat or things like that, that if you're separated from that would alert you to it. But there are also very low-cost ways in which you can prevent these from happening. These are some of the resources that we have available. The one in the middle is actually the one that the heat stroke death that occurred in North Dakota. The mom did create a brochure with us, and we have this available along with this orange look sticker. This vinyl cling is available. It could go up in businesses on their window. If you would like one of those, you can reach out to us for those as well. We also have this temp display that is meant to be in a parking lot with a car. One sensor is in the vehicle, the other one is outside, showing the difference between the outside temp and the inside temp. I'm listed some resources. I won't go into them because they will be included. And the fire safety information that I've included in the presentation is just a lot of resources about fire, campfires, fireworks, gasoline fire, and then some resources available to you around the topic of fire safety, because that's clearly a big summer safety topic. I don't necessarily need to read the slides to you. They'll all be included in the handout that Mary sends you from the presentation. So with that, I also included in the presentation that will be sent out a bunch of announcements. I'm going to quickly flip through them about a bus training, injury prevention workshop we have coming up next year, how to sign up for our website, and a lot of resources. So with that, that's my contact information. If anything we've talked about today has sparked your interest, or you know of a way that you could help or want to learn more about it, you will find all of the resources in the handouts that will be available from Mary.
Wonderful. So much great information and perfect timing, as well as people are camping, heading to the lake and starting to go to pools. So thank you so much. I did pop the evaluation survey QR code as we see if there's any questions that have come in. If you wouldn't mind taking that. I had one for you. Well, one thing I should share is I have used that swimsuit guide and have shared that. I think that's something really important, is the color of swimsuit, and then the difference between it in a pool and a lake as well. So that's really interesting to me.
Especially if you're at a pool. I know my daughter or my sister was talking one time about how she picked out a couple different styles of swimsuits for her kids and said, these are the ones you get to pick from, because she knew that they were very different swim capabilities. And one would be in the deep end and one would be in the shallow end. And when you're scanning the pool, looking from end to end, if they're in a bright color that's easy to visualize, rather than the navy blues or the, all the same colors, it makes it easier to do that visualization as well.
Yeah. So question for you, and maybe you covered it and I missed it. If you have some life jackets that, your kids have grown out of and you don't need them anymore, is there like a disposal location for those? Or is there, like, what do you do with those old ones?
Well, so a couple things. When you have a life jackets do not expire like a car seat does. But that being said, they can lose their float ability. So we encourage people every spring when they're out checking the size of that life jacket to make sure it's, it's they're fitted by weight. So making sure that it fits still. The buckles all are in good order. You want to make sure the mice didn't get into it and chew a hole in it. What you want to do is put that life jacket on and walk out in the water till you're about shoulder height, and then lift your feet up off the ground and make sure that it still actually will float you in the water, because over time the heat and the cold can be hard on that flotation, or if it's pressed down in your boat under the cushion, or just takes on water for some reason. If it was punctured and takes on water, it might not function well. If that's the case, what I would do is I would cut the buckles off. I would destroy it in some way and throw it away so somebody doesn't take it out of the garbage thinking it's okay to use. If it's one that a child has simply outgrown, there are places such as the life jacket loaner stations or our Safe Kids where we will take them to use for teaching purposes, or to put in our loaner program if they're still in really good condition.
Mhm. Awesome. Thank you for that. Um, and then one more, I'm not seeing any that have come in, so I'll ask another one. Um, this is also around water safety and nannies and caregivers who might be taking care of your kid if you're at work. Do you have like a little, just a little guide that you could hand out to those individuals? I know you had the water watcher, but just like, if you have a nanny and you have, a list of things that you need them to know. Do you have a little cheat sheet
It,
like that?
it's interesting that you asked that, because that actually is, we were talking about starting a nanny class that we would do
Mhm,
online each spring, ahead of like high school kids or college students starting to nanny for a family or whatever.
mhm.
And so we kind of have a list of things that we've talked about including in that class. I would envision that a handout would go along with that. We don't have it created yet, but it is on our list of things that we would like to put together for that very purpose. Because
Awesome. Well, I can't wait.
things like, do the nannies know how to use the car seat? Do they know that if they're riding the bike to the ballpark, that they should wear a helmet to be a good role model to the kids? What does water observation mean? Yeah, absolutely. There's a lot of things. So it's on our list. So you've inspired us to maybe kick it higher up on our list of priorities. But it's something we've talked about as we implement a potential nanny training course.
Oh, I look forward to it. I have a nanny and she's amazing, but I can see how this would be helpful, just to have that all in one list. We did have one question that came through as regarding the life
I saw.
jacket loaner. Is it washed before?
Yep. No, they're not. They're simply like hung up to dry. And they're just no, they're not. There isn't, and you really don't need to wash a life jacket. I mean, if you have concerns about wearing a life jacket that somebody else has worn, you might be somebody that might want to purchase your own life jacket. But they're interchangeable. They're left at pools. Pools will use them at the side of the pool, and they're not clean between them. So what we do though, our life jacket, the people that run the loaner program, if they notice, for example, that it smells like smoke, or they're getting dirty, or is something like that, we replace them. But there isn't a need to wash them. In fact, there's not a great way to wash a life jacket after use. So, but that's a great question. Thanks for asking.
And what a cool thing to have those available. I really love that.
Yeah, particularly, if people forget, they're likely not going to haul their boat out of the water and go back to a place where they can buy one. I mean, a lake or a river could be a long distance away from, where you might be able to access them. So having them in a variety of sizes, for anybody that might be in that boat, is really our intention. Not that they can't be used by swimmers by that boat ramp, but I do know that both the Cito Foundation and the Game and Fish do ask that they're not put up like in a private like marina
Mhm,
that is only allowed by marina owners or members type of a thing, but a public space and a space where the boat ramp is.
mhm.
And again,
Awesome.
the application for the Cito Foundation Life Jacket Loaner Program, that is actually, it's a stand that sits on the ground and you fill it with sand or water. And then it's got like almost like arms, 4 arms that come off of it that the life jackets hang on. And we have somebody who is responsible for that stand, and they go out and they do like a monthly check of them to make sure that the life jackets are still all there, that they don't need to add more to the site. And then they check every, so often the buckles, that they're not torn or worn or dirty or that kind of thing. But the application to do that CETO Foundation grant is quite easy. We've done them successfully for several locations. So if anybody is interested in learning more about that or having our help with writing for that grant, I would be more than happy to do that for people in our state.
Wonderful. Awesome. I don't see any more questions, so we will move to closing up here. Thank you again, Karma. This was such wonderful information. I know it was a lot, but it's so important. And thank you to everyone who joined today. And to stay connected with us, you can visit Healthy NODAC on Facebook, Instagram, and Twitter, and Foundation for Healthy North Dakota on LinkedIn. And also you can follow the link to join the coalition. And then also scan the QR code one last time to take the evaluation survey. And that concludes our webinar. So thank you everyone again. Enjoy your day.
Thank you.